Okay, so what we're going to be doing here is looking at self-mobilization for, say, tight or restricted soft tissues, fascia in particular, but you could lump the muscles in there as well. But the fascia, it tends to be a little trickier, especially if you've had surgery or if there's any kind of scarring in that area that could kind of be wrapped up, bound up within that fascia, which fascia is more plastic than elastic, so it doesn't respond as well to a quick stretch, and that's kind of the point, is that it holds our body together cohesively, so it keeps our body in the body shape and keeps it from getting distorted or getting overstretched in any one way. It kind of snaps everything back into place. So to stretch fascia, you have to do more of a slow, prolonged stretch because it takes more time for it to actually adjust and adapt to a different position. So if you've ever been sitting for a long time and then gotten up and felt tightness, but then it kind of goes away pretty quickly as you're walking and moving, that can be the fascia that's kind of gotten locked up. And as you get into more of a rhythm and different movement pattern versus more static, things shift over quickly to the muscles, and then they're more adaptable than the fascia. So the fascia starts to let go with the understanding that the muscles are taking over, okay? So that's where we want to make sure if you have a fascial restriction or muscular restriction or both, myofascial will be both. So we want to have some ability to kind of maybe help things along if it's causing pain or problems for you mechanically. So that's where we're going to focus on here. So this is going to be related to the knee in particular. So we have to be able to straighten the knee and flex the knee, so extension and flexion. But there is also a rotational component. So I apologize, I'm not wearing shorts here, so you can't see like the skin. But when I twist and turn, like my foot, twisting, turning, so when we extend, there's an external rotation of the distal part, the tibia and fibula, and when we bend, it flexes more in to internal. So we want to consider that because that helps to also dictate the path of the patella as it glides up and down. So when we go into extension, given that the tibia and fibula are turning outward, that's where the kneecap, when we tighten the quadriceps muscles, pulls up, but it doesn't just pull up, it pulls up and out slightly. Now we do have the VMO here on the inside to anchor it so it doesn't go too much, the checks and balances kind of thing. But we do want to make sure that that patella, not only does the knee straighten out, but we get this rotation of the tib fib relative to more internally turned in femur, that pulls more outward from the lower leg. And then the patella, we want to make sure that it's going up and out towards the outside pocket here in my hip, going in that general direction, okay? So if that's a problem, I can put my leg, I may want to have it more supported, like all the way up here, or maybe I'm just sitting on the ground or on a bed, but I'm going to try to maybe engage the quads a little bit to help out and just gently kind of take up the slack here. Don't need to do much more than that. Don't need to really crank on or anything, but just take up the slack and hold it and keep that stretch, if I feel a stretch there, in that general direction of up and out towards my pocket. Okay, now if I'm going into flexion, my lower leg's gonna be turned in slightly, and my outer leg, think of like a squat, is gonna be more externally rotated, opened up that way. So I wanna make sure my femur is out that way, relatively turned in here. And then my patella, in that position, if I'm going into the squat, is gonna be going down and in towards the inside of my heel or ankle there. So just, again, just gently and kind of taking that, and maybe I can lean into that. Maybe I'll put my foot up on a step. This is maybe a little high for most people, but on a step, like on stairs, I could hold on maybe with one hand and try to guide in and kind of just nice and easy. Just take up the slack and hold. Now once it's loosened up, I can kind of reinforce that motion here or reinforce the motion here, right? As long as I'm supported and stable and not gonna fall. Or even just here, it's a little hard to reach, but I could just do like a standing and my knees coming up and out, or one knee up and out, or bending down and in. My hip goes out, but my kneecap with the patella, I could do kind of maybe both here too, can turn in versus turning out. It's kind of that flow like so. So those are things that are hopefully helpful to help release some of the tension there, not forcefully, but just nice and gently, and try to really guide the flow of the kneecap there, because it's important, because if it gets hung up, it'll cause that compression, pain, patellofemoral symptoms there. So the mechanic is very important.